Software programs that we have purchased to prepare and maintain our medical records electronically have not met our specific needs. So one of our physicians worked in Microsoft Word to develop a series of macros for each element of the medical record based on normal findings. For example, for a patient's first visit, the name, date of birth, visit date, chief complaint, and history are keyed in as they are unique information. The review of symptoms is based on the patient's denial of a list of symptoms. Any symptoms that are present are deleted and listed at the end of the section. Similarly, medications, medical problem list, and list of surgeries have only the positives to be keyed in, whereas family history, social history, habits, and allergies are unique information and have to be keyed in as such. For the physical examination, in this case male, vital signs are unique information and are keyed in, but every other section is based on normality. Any abnormal physical sign has the normal deleted and the abnormality inserted. The elements of the assessment and plan are unique information and are keyed in. Using the SOAP system described in this series, return visits are keyed in by the doctor after the patient is seen. Other macros based on normality have been developed for X-rays, lab results, ECGs, and consults. The record can be printed and is stored both on the hard drive of the computer and in a paper record. The advantages of having the record stored electronically are a clean, legible record, instant access to the record without paper search, a record available at any computer in a networked office, direct updating by the physician and medical assistant, easy printout of appropriate sections for referral or insurance purposes. To ensure confidentiality, each staff member's secret code must be programmed to allow only need-to-know access. Patient account management is the most widely used computer application in medical offices. The advantages a software management program offers include automatic creation of patient charge slips at each visit, calculation of the charges, creation and updating of the ledger card, transfer of data to insurance forms and statements, aging of accounts at billing cycle, and creation of billing statements. This computerized management of accounts places patient data into several applications with only one input. It eliminates costly human errors, relieves medical office staff from routine, time-consuming activities, accelerates the collection process, and increases practice collections. After each patient visit, the computer generates an itemized billing statement and a patient ledger which lists all previous office visits with their dates, procedure codes, procedure names, charges, payments, and adjustments for each visit. The ledger also shows amounts that are delinquent. The ledger can be called up on the screen or printed if a patient makes an inquiry about the account. Each month, the computer can be directed to search the patient database and print billing statements for patients with outstanding balances. The statement shows the amount due and how many days it is delinquent. A short phrase or message can be used to promote payment. The computer can also generate an aging monthly analysis of the accounts receivable. Aging defines how many days each account is delinquent and then analyzes them as a percentage of the total dollar balance or the total number of accounts. The delinquent balance can also be analyzed by account type to determine how patients, Medicare, Blue Cross Blue Shield, or other private carriers are paying. This analyzes the charges by month and year to date, the charges by type for the month and year to date, and the payments by type for the month and year to date. The billing cycle can be monthly or can be staggered by an alphabetic breakdown or by day of service to provide cycle billing. This relieves the pressure of mailing all statements at one time and generates cash flow throughout the month rather than at only one specific time.